Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'll be explaining the radiology lecture of this block. So bismillah, let's start. In this lecture we're going to talk about the glands and each gland's preferred image modality. So here we have like a summary that has the first modality of choice for each gland. You'll understand it more when we go through the lecture. And then we're going to talk about the clinical cases, some of the clinical cases and how we can see them like in the radiology point of view, okay? So first of all, here we have imaging modalities: X-ray, ultrasound, CT and MRI, and radioisotopes. So for the X-ray, it's no longer used like nowadays. Ultrasound are commonly used for the thyroid gland. CT or MRI are used for most of the glands, and then the radioisotopes are used to assess the function of the thyroid and parathyroid gland. So we use them mostly to assess the function, okay? Starting off with the pituitary gland, this is just anatomy information. It's telling us the pituitary gland has anterior lobe, posterior lobe. It's not very important for the radiology lecture here, okay? So first of all, we need to know that the most important or the gold standard imaging modality for pituitary gland is MRI. So remember, pituitary gland, first choice for the image modality, we're going to use MRI. تمام? It has no blood-brain barrier. That's why it's normally enhanced by contrast. يعني لما we add contrast, when we are using MRI, we add contrast to the pituitary gland, it appears as white or it appears whitish, okay? ليش؟ لأنه it has no blood-brain barrier, okay? So when is it used? When do we use an MRI for the pituitary gland? We use it usually for suspected adenoma, either microadenoma or macroadenoma, or post-surgical surveillance. That means after resection of pituitary mass, يعني after removal of pituitary mass, after post-surgery, يعني بعد العملية, we use an MRI to make sure إنه there is no more of the mass left or ما في بقايا من الماس. So why do we use MRI over CT? Because advantages of MRI is that it's superior spatial and contrast resolution without artifact, unlike a CT. What does this mean? This means إنه بالعربي كذا إنه دقيق أكثر من CT. يعني MRI يورينا الجلاند بدقة أكثر أو بتفاصيل أكثر, okay, than a CT. This is for the pituitary gland. تمام? Without artifact means unwanted shadows. So في MRI we can see the gland more specifically and in a higher resolution without any unwanted shadows. Unlike a CT, in the CT we can see we have unwanted shadows and it's not as clear as the MRI, okay? This is for the pituitary gland. طيب. Second line is the CT. We said we use CT, but the first image modality choice is going to be is MRI, and it's used mainly for to plan transphyseal hypophysiectomy. Okay, this is the main use of the CT and the pituitary gland. طيب. So here it's telling us again that MRI is the first choice to demonstrate the presence of extent of a pituitary tumor. تمام? So here we can see the three image modalities اللي هما X-ray, CT and MRI, okay? So we're going to start from the least used to the most used. So X-ray, we said it's no longer used أصلا. So it's just showing us here that previously they used to know if there's a tumor or not through X-rays. How would they know? They will measure this diameter and they'd see if the diameter is normal, that means it's normal. If it's enlarged, that means there's a tumor, okay? But it's no longer used. Then we have a CT, which is second choice, we said. So CT, as we know previously, CT always shows or the bones appear white. So once you see white كده bones, that means this is a CT scan, not a MRI, okay? With MRI, which is our first choice and the best one, we can see the bones, but they appear grayish black, okay? So this is our first choice and best choice, okay, for the pituitary gland. طيب, here we have the clinical application, prolactinoma. So we know prolactinoma. What is prolactinoma? It's a prolactin-producing tumor of the anterior pituitary gland. So an anterior pituitary gland produces prolactin. This is all this is not related to radiology, okay? So I'm going to focus more in the explanation on the parts which will be asked for the radiology part, okay? So يقول لك هنا all we need to know for this is an MRI and this is a CT scan. تمام? Here we have macroadenoma, and macroadenoma is just like for general information. How do we decide if this is micro or macro? Macro is usually more than 10 millimeters. تمام? So when it's more than 10 millimeters, that means this is a macroadenoma. If it's less than 10, that means it's micro. تمام? Here we can see this is the pituitary mass or adenoma. Here we can see them. And here we have the pineal gland, which we'll be seeing in a minute, okay? So let's move to the pineal gland now. البنيل gland برضو first choice or modality of choice is إيش MRI, just like the pituitary gland. So pituitary and pineal, both of them, the first choice is MRI, okay? But there's one thing here we need to remember, that for the MRI there's a disadvantage for the pineal gland, that the pineal gland is usually calcified, or it can be calcified. Calcification يعني, and we know that calcification shows more on the CT scan. So on the CT, calcification or bones appear whitish, or they appear very white, so we can see them clearly. However, in the MRI, it's not very sensitive to calcification. That's why it appears grayish or black. So we can't really see it very clearly. But it's still the first choice. Yani MRI is still the first choice for pineal gland. Okay? So here we see MRI is the modality of choice. Although sensitivity to calcification is it's poor. That's the disadvantage. برضو it's telling us MRI is a gland that appears small, nodular of tissue. We're going to see it in a minute. And similar intensity to gray matter. What does this mean? Iso-intense to gray matter. يعني, here we can see this is the pineal gland. It's very small. Iso-intense means إنه it's the shade of gray, or the shade of color is similar to the rest. Okay, so we can see إنه it's not مثلا too white and it's not too dark, and we can't really differentiate unless we really look closely. Okay, so it's almost the same shade of gray as the other structures. Okay, however, if we see it in the CT here, we can see and we can clearly identify the pineal gland لأنه it's white, and we said calcification shows in the CT. تمام. بس the MRI is still the first choice for pineal gland. Here we have the anatomy part, which is like the structure, or where exactly does the pineal gland lie. Let's see it here. Okay, so it's telling us, actually let's see it here, it's more clear. Okay, and then we'll open it here so we can don't go back and forth. So هنا it's telling us the pineal gland is, where is it exactly? It's a midline structure, and it's in the middle. Okay, it's a midline structure, it's in the midline هنا كده, and it's between the two thalamic bodies اللي هم thalamus, right والleft thalamus. Okay, and it's the posterior most aspect of the third ventricle. Here we can see this is the posterior, it's posterior to the third ventricle. تمام. And it's below the internal cerebral vein. Internal cerebral vein, we can see it here. So this is the internal cerebral vein, so it's below it. تمام. This is the anatomy. Okay, calcification is normally seen in the pineal gland, we just said this, always visible in the CT. تمام. طيب, now let's move to the thyroid gland. Thyroid gland, first image modality is ultrasound. Okay, for the thyroid gland, it's the ultrasound. So what is it used for? It's used for assessment of the thyroid vascularity, goiters, and thyroid nodules. تمام. Also, it determines whether the nodule is cystic or solid, or a mix of both. And why is this important? This is very, very important in the diagnosis of the patient. So the physician needs to know whether this nodule is cystic or solid, or both, يعني a mix of both. تمام. Also, we can use FNA for confirmation of diagnosis of thyroid cancer. This is very important. What's FNA? It's fine needle aspiration. So we use the FNA for the confirmation of the diagnosis of thyroid cancer. This is important. طيب, but then other modalities we can use are nuclear medicine techniques اللي هو زي iodine. This is important for investigation of abnormal thyroid function. Okay, and remember in the beginning, in the introduction, when we were mentioning the different modalities, we said that the nuclear medicine technique are used for the function, to assess the function of the thyroid or parathyroid. So here it's to assess or to investigate any abnormal thyroid function. تمام. And the CT is not often used, but it's only used in one case, which is to demonstrate the extent of retrosternal goiter. So the only case for the thyroid gland where we use CT is to demonstrate the extent of retrosternal goiter. تمام. Here we can see this is the ultrasound. So here it's the same thing. Okay, so this is the trachea. Here the trachea. This is the isthmus. نفس الشيء هنا. But then the right lobe and left lobe of the thyroid, jugular vein, etc. Okay. Here CT. Here the MRI. We know the CT because it's very white. Here the bones are very white. Here it's grayish black. Here we have the radionuclear image of the thyroid. تمام. So this is the right lobe and left lobe. تمام. طيب, now let's move to the clinical application. الgoiter imaging. For الgoiter we use the ultrasound to determine the size, nodularity and consistency of this goiter. تمام. Also يعني after that further on we can use CT or MRI, ولكن the first choice is إيش ultrasound. Then for interventions as we said above we can use fine needle biopsy. Okay. Then we have hyperthyroidism, also known as Graves' disease. Okay, so here is just information about hyperthyroidism, not important for the radiology part. Let's see the radiology part. The radiology part here is إيش في hyperthyroidism. What do we use? What's the first image modality? We use thyroid scintigraphy, which is 99 MT whatever, or iodine. Okay, and what do we see, or what appears? What's the most significant thing that we can see? That it's enlarged. Okay, the thyroid, both of them are enlarged, we can see, and there's high uptake of iodine. تمام. And we know in hyperthyroidism we have high uptake of iodine, but how much exactly? It's 25%. Okay, so what's the normal range? The normal range is between 0.5 to 2. So imagine it's 25%, so that's like a very high uptake. Okay, so this is just for the hyperthyroidism or Graves' disease. Now let's move to the parathyroid. So for parathyroid gland, our first modality of choice is radioisotopes. So we use radioisotopes for parathyroid gland. So normally parathyroid gland يكون behind the thyroid. Okay, so it's not visible on ultrasound. So if the parathyroid is normal, we cannot see it. It's invisible في ultrasound. However, when we have parathyroid adenomas, we can see it ليش؟ لأنه there's a mass lying right behind the thyroid gland, so it's visible on ultrasound when there's parathyroid adenomas. Okay, normally it's not visible on ultrasound. So here we can see this is إيش ultrasound when there's a parathyroid adenoma, so we can see it. It's visible. There's a mass right behind the thyroid gland, and we said it's widely used in radioisotopes. Okay, this we can skip it, not important. But then we have clinical application. Clinical application we have the hyperparathyroidism, primary hyperparathyroidism. So primary hyperparathyroidism, to evaluate renal with skeletal manifestations. It's important for the confirmation of primary hyperthyroidism and to evaluate the renal and skeletal manifestations. This is very important. It's a site of questions in the exam. Okay, so focus on these two especially. Okay, a skeletal evaluation with renal imaging. A skeletal evaluation, what do we assess for skeletal evaluation? The osteoporosis, the osteopenia, and fragility fractures. What do we use for, like, what's the image modality used here, like, or the preferred modality used? DEXA scan. Remember DEXA scan? So we can either write it DXA or DEXA scan like this. Okay, so for skeletal evaluation for osteoporosis, osteopenia, fragility of fractures, we use DEXA scan. The alternative imaging technique is vertebral X-ray. تمام, but first choice is DEXA scan. For the renal imaging, what do we assess? We assess nephrolithiasis and nephrocalcinosis. Okay, so these two, what's the imaging technique used? First imaging technique used is CT without contrast. Okay, بعدها we can use ultrasound or X-ray. This first choice for the renal imaging is CT without contrast. Okay, this is for primary hyperparathyroidism. تمام. And then we have آخر شيء neck imaging. We either use ultrasound for the neck and we use them together, يعني ultrasound neck and nuclear imaging. Okay, these are the two options we have, but these two are important for questions, so focus and remember them. طيب, but then we have the adrenal gland. Adrenal gland, what's the imaging modality of choice? CT. طيب, for the adrenal gland we use CT. تمام. So enlargement of the adrenal gland is recognized on CT and also like after CT MRI and sometimes ultrasound, but mostly or the first choice is CT بعد MRI بعدين sometimes ultrasound. CT is the best technique that diagnoses adrenal enlargement. تمام. طيب, here we can see this is the anatomy برضو of the adrenal gland. تمام. We're gonna see it here because it's more easy to understand. So let's go here. Okay, so it's telling us a right or left. Okay, so we know we have two adrenal glands. We have the right and the left. So let's start with the right. So for the right one, we can see clearly this is the liver, right? So it's telling us it's it's above the kidney. طبعا we know that. And then we know it's behind. This is the inferior vena cava. So, and wait, let's start from again من الأول. This is the right side and this is the left side. We know this from previous lectures, okay? And this is the anterior of the patient and this is the posterior. تمام? These are also like basics we should know. تمام? When reading any CT or MRI, okay? So we know this is right, this is left, this is anterior, this is posterior. تمام? Now let's identify the structures. هنا this is the liver. تمام? هنا if we zoom in we can see the adrenal gland. The adrenal gland is like an inverted Y shape. Here it's more clear إنه it's inverted Y shape. هنا شايفين كيف it's كأنها Y shape مقلوبة. Okay, so it's an upside down Y shaped structure. تمام. So behind the inferior vena cava. So قلنا behind the inferior vena cava, هذه inferior vena cava, this is the posterior part of it. Posterior to it we have the adrenal gland. The right lobe of the liver lies on the lateral aspect of the right crest. So هنا this is the right lobe of the liver. خلاص, it's laterally to the adrenal gland. So the adrenal gland is posterior to the inferior vena cava and lateral to the liver. تمام. What's medial to it? Medial we have the diaphragm. تمام. What about the left side? The left side, here we have the liver, here we have the spleen, right? And we have the pancreas here. We're gonna see the pancreas in a bit. Okay, so هنا يقول لك the same thing, إنه it's on the left kidney. Here it was on the right kidney, it's on the left kidney. So the diaphragm is medial, just like this one. The right one, برضو diaphragm is medial. So on both sides, the diaphragm is medial to the right and left adrenal glands. Okay? Then we have the spleen, which is lateral to it. So هنا lateral, on the right side, the lateral part is the liver. On the left side, the lateral part is the spleen. On the right and left side, both of them, the medial part is the diaphragm. تمام? So medially we have the diaphragm for both sides. آخر شيء we have superior to it or anterior to it, we have the tail of the pancreas. So the tail of the pancreas is anterior to the left adrenal gland. Okay, so for this part I'm not quite sure if they're gonna ask about it, but just know it because it's like the anatomy of the structures. Okay, طيب بعدين we have هنا, this is the same thing, this is في MRI, this was in CT, this is MRI. بعدين هنا, this is important, adrenal adenoma. We can see هنا, we said that adrenal gland looks like an inverted Y, right? So here we can't see the inverted Y. Why? Because it's replaced with a tumor. Okay, so that's why this is adrenal adenoma. This is very, very important. This is a site of questions. The doctor himself said, and we ask about this. Okay, so adrenal metastasis. Okay, adrenal metastasis is, what does it mean? إنه different tumors, metastasis يعني التيومر يتحرك من مكان لمكان. Okay, so the adrenal, most different tumors move or metastasize to the adrenal gland. Okay, specifically or particularly which type? Lung carcinoma. طيب, so if a patient is diagnosed, okay, with bronchial carcinoma or lung carcinoma, adrenal gland must be checked. Okay, so we have to see the adrenal gland في CT scan or like a chest CT scan so we can see the adrenal gland. تمام. لازم نشوف adrenal gland if there's a lung carcinoma or bronchial carcinoma. Okay, so this is very important. طيب, last thing we have is the pancreas. For the pancreas, what's our primary or first image modality? It's also CT. So عندنا نقول الادرينال والpancreas CT scan. Okay? Adrenal and pancreas, both of them CT. تمام? So what's the advantage of the CT? It's over the transabdominal ultrasound. What's the difference between transabdominal ultrasound and endoscopic ultrasound? Transabdominal ultrasound اللي هو الالتراساوند اللي يكون external from outside. Okay? And the endoscopic ultrasound, from its name, endo, يعني it's internal. Okay, so we use this when we want to take a biopsy or and we use it more for diagnosis. Okay, so why is CT better than the ultrasound in general? Because ultrasound, we know when we have gases, okay, when we have gases around the structure, it's very difficult for the ultrasound to give us a clear image. So it gives us a low quality image. الإيمج ما تكون واضحة. أما ال CT لا بالعكس, it shows us a clear and like visible image. Okay, so this is why the CT is our preferred image modality for the pancreas. تمام. We said endoscopic ultrasound, it's used for diagnosis and biopsy. طيب, here this is the anatomy of the pancreas. It's not very important, but we can just see it here. So let's go here. Okay, so we have the head of the pancreas is here. Okay, and then we have the body and the tail آخر شيء. So we have these are like the parts of the pancreas. And then we have the most important structure associated with the pancreas, which is the splenic vein. Is the most important structure associated with the pancreas. Where is it exactly? It's inferior to the pancreas. Or in other words, we can say that the body of the pancreas is superior to the splenic vein. Here we can see إنه في ultrasound. So this was a CT and this is a CT and this is MRI. Okay, And here في ultrasound we can see that the pancreas is not very clear, يعني we can't really see it exactly, but we can see the splenic nerve, the splenic vein, sorry. Okay, so we can see the splenic vein here, and that's why we said this is an important structure associated with the pancreas عشان نقدر نحدد من خلالها where exactly the pancreas is on the ultrasound. Okay, so by that we have finished the lecture. Remember this table or use it for revision because it's very important. خلاص. And go over like the things that we mentioned that are important, like the clinical applications and so on, and remember this very well.